Somalia stands resilient against a number of public health challenges. Today, we celebrate a remarkable milestone, the launch of the 6th cohort of Somalia Frontline Field Epidemiology Training Program, known as the Frontline FETP. FETPs are modeled on the United Nations Center for Disease Control and Prevention's successful Epidemic Intelligence Service program, but are overseen and managed by individual countries and ministries of health.
The Federal Ministry of Health and the National Institute of Health of the Republic of Somalia, in collaboration with the African Field Epidemiology Network, U.S. Centers for Disease Control and Prevention, and with the support of WHO Country Office Somalia, were established Frontline Field Epidemiology Training Program. Somalia Field Epidemiology Training Program was inaugurated in August 2021 in Somalia. Field Epidemiology Training Program is competence-based in service training that helps to improve the capacity of health authorities to detect, investigate, and respond to disease outbreaks effectively and efficiently.
The frontline tier implemented in Somalia focus on quickly scaling up public health capacity at the local level to more quickly prevent, detect, and respond to emerging disease threats.
So as you know, Somalia is located in the Horn of Africa, which is the most vulnerable and fragile region in terms of infrastructure, the health system, and there are conflicts here and there. So it's a very critical and valuable program for as a country, for Somalia, and also as a region, because building the Somalian health system is building the health system of the region. As you know, outbreaks doesn't have border. They don't need visa to cross borders. So if we stabilize and if you work on strengthen the health system of Somalia, we are strengthening the health system of Kenya, Ethiopia, and Djibouti. So when we see the impact in the last I think years since we established the program in Somalia, the Somalia health system, surveillance system is improving. For example, in terms of timely reporting, completeness, residents are also building the health system in the state, in each states of the Somalia government.
In 2021, the Somalia Federal Ministry of Health and National Institute of Health launched the first Somalia Frontline FETP cohort. In collaboration with the African Field Epidemiology Training Network and the United Nations Center for Disease Control and Prevention. Starting with the launch of Cohort 5 in 2023, the Federal Ministry of Health and National Institute of Health expanded and strengthened their collaboration with global partners, including the World Health Organization, UNICEF, the African Field Epidemiology Network, and the United Nations Center for Disease Control and Prevention. Somalia faces outbreaks of polio, measles, diphtheria, cholera, and other vaccine-preventable diseases. In preparation for launch of the first tailored Somalia FETP throughout the program, technical experts provide specialized training to residents on vaccine-preventable disease, surveillance, routine immunization, outbreak response, and geospatial mapping from the World Health Organization, UNICEF, the African Field and Epidemiology Network, the United States Center for Disease Control and Prevention, Somalia Ministry of Health and National Institute of Health.
waxaan joogaa xaruntan Wabrial Center oo aan ka soo shaqeynay muddo aad u fog marka hawshana si fiican ayay noogu socotaa tababar badan oo la soo qaatay jirto tababarkii ugu dambeeyay wuxuu ahaa IDSR-ka kaas oo looga wareegay e-warning-ka oo looga wareegay cudurradiisa iska koobnaayeen kan aad ay u farbadiyeen cudurradiisa marka ilaa 22 cudur ayaa la soo gudbiyaa weekliga ilaa 7 42 bishii la gudbiyaa marka e-warning waa la bedelay hadda IDSR loo bedelay oo app lagu gudbinayo marka maalin kasta oo axada ayaan la gudbiyaa IDSR-ka train kan soo qaadanay train aad noo anfacayo sababtoo ah markii hore oo UN-ka training badan ma haysan cudurradan way iska koobnaayeen hadda cudurradii way bateen.
Outbreaks of circulating vaccine-derived poliovirus type 2, known as CVDPV2, has increased over the last decade. To stop vaccine-preventable disease outbreaks in Somalia, including CVDPV2, high-quality vaccination campaigns must be implemented quickly to interrupt transmission and prevent disease spread. 3 graduates from the first cohort now hold leadership positions, including the head of National Emergency and Surveillance, the director of the National Public Health Laboratory, and the Surveillance Officer of Maternal and Child Health in Benadir region. Their continued involvement and support for the Somalia FETP guarantees sustained local interest in the program, particularly in security-challenged areas.
The FETP Somalia is now in its 60th cohort, and this has showed the commitment of the Somalia government, the National Institute of Health, which is the technical agency on behalf of the Federal Ministry of Health implementing this program, as well as the Federal Ministry of Health, which is providing oversight and leadership for the program. It has also showcased the capacity and commitment of the implementing agency, which is African Field Epidemiology Training Program, which we see that they are competent and have the capacity to provide assistance and technical contribution towards implementation of this program in Somalia. We are happy that the program has convened in its 60 cohorts, and we look forward to start convening the intermediate course. We are going to train additional 300 frontline field epidemiology training program, and we concluded training close to 150.
Program FETP waxaan rabaa inaan idin la wadaago saameynta uu ku yeeshay FETP program dhalinyaradii qaadatay waxqabadka iyo shaqada gobolka Banaadir. Marka la eego surveillance-ga gobolka Banaadir waxaa markii ugu horeysay aan ku shaqeynayay hadii aan dib idin xasuusiyo program la yiraahdo E1. FETP wuxuu ku soo beegmay ayadoo laga guuray E1 system oo loo soo guuray markaas ADSR, laakiin wali shaqadii ayna bilaaban. nasiib wanaag dufcadii ugu horeysay ama koortii ugu horeeyay markii la qaatay waxaan dawladda iyo wasaaradda caafimaadka ay fureen barnaamijka ADSR ayadoo oo waddanka ku cusub yahay. gobolka Banaadir wuxuu chance u helay inuu noqdo meesha ugu horeysay ee programkaas lagu qabto, inuu hosti gareeyo oo caasimaddu ay noqoto meeshii lagu qaadanayo waxbarashadaas. opportunity fiican ee gobolka Banaadir u ahayd. sidaas awgeed dhammaan dhalinyaradii ka qalin jabisay FETP program waxay sameeyeen waxqabad iyo inay ilaaliyaan daatada degmooyinka ay soo geliyaan ADSR.
dufcooyinkii kala duwanaa ee ka soo qalin jabiyay FETP-ga agaasinka caafimaadka wax badan ay kordhiyeen. ka qorsheyn ahaan waxaan u isticmaalnay dadkaas ka soo qalin jabiyay FETP-ga inay dhisaan aba xoojiyaan qaybtii surveillance-ga. waxaan restructuring ku sameynay organogramka oo ku shaqeeya agaasinka caafimaadka. sectionka surveillance-ga ayaan input badan iyo xog badan gelinay si cudur dilaaca soo noqnoqda case lagu sameeyo outbreak investigation rasmi ah oo runtii markii ugu horeysay oo agaasinka caafimaadka uu sameeyay outbreak investigation. waxaan uga mahad celinaynaa Ustaad Qaasim oo in badan naga support gareeyay in investigationadaas ay si sax ah maaragtay loo qabto. sidoo kale agaasinka caafimaadka asagoo ka duulayo xogaha maaragtay ka yimaada xarumaha waxaa markii ugu horeysay oo soo saaray waxa loo yaqaan epidemiological weekly bulletin sanadkan. waxayna ka mid tahay waxyaabihii ka dhashay FETP-gii dadkaas ay ka soo qalin jabiyeen. marka waxaad dareemaysaa muhiimadda uu leeyahay bulshada in la helo saraakiil oo frontline ah oo markasta u heegan ah cilmigeena lagu soo qalabay inay agaasinka caafimaadka ay diyaar ku ahaado.
mana uga dhigna programka qof la tababaray in uu ka dhigo sidii caadiyan bal arki jiray in tababar la galo shahaado la qaato kadibna CV-ga ama meelaha inta lagu qorto la yidhaahdo maalin unbaa ka qayb galay tababarkaas ujeeddada rasmiga oo aan ka leenahay waxaa waaye inaad lafdhabar u noqotaan dhammaan howlaha ka socda health systemka ee dalka Soomaaliya taas waa markaa sababta aan ugu dhiiranay in aan saxno kriteeriyada uu leeyahay programkan FETP-da dhammaantiin waxaa idinku soo xulnay qof kasta shaqadii uu ka hayay gobolka iyo degmada uu ka yimid ee ku tacalluqday curriculumka ama FETP-dan kriteeriyada uu leeyahay oo ah surveillance-ga laboratory-ga iyo EBI-da.
The launch of Cohort 6 in July 2024 marked a significant milestone. The cohort includes 25 health workers from various states and districts of Somalia, continuing the program's mission of health workforce development. The State Minister for the Federal Ministry of Health, Mariam Mohammed Hussein, praised the explained selection process and highlighted the program's role in supporting epidemiology, gender equality, and early preparedness. She also championed women's involvement in public health leadership.
And Somalia, even this year, has again faced multiple upsurges of communicable diseases. We've seen cholera, measles, malaria, dengue fever, and diphtheria. Unfortunately, we also seen climatic shocks. We've had droughts, we have floods that all further impact the spread of communicable diseases. And all these events require strong human resource capacities for surveillance, preparedness, and response. All these events also highlight the need for a robust approach for timely detection, accurate data collection, informative analysis, laboratory confirmation, and immediate response. Because this is how we will save lives and mitigate unnecessary disease and death. For the last several years, WHO has been working with the Ministry of Health to strengthen the health system, to strengthen health institutions. And human resources are the most important. Without people, without healthcare workers, there is no health.
The launch of the 6th cohort of the FETP presents a critical step in strengthening Somalia's health workforce, ensuring that current and future generations benefit from improved public health decision-making and preparedness. Through dedicated and unrelenting collaboration with partners, Somalia FETP has broadened their impact to strengthen and improve the quality of vaccine-preventable disease prevention, detection, and response activities in the most at-risk geographies.
The program has contributed an impact on this country. Previously, there was no national weekly bulletin. Now, it produces national weekly bulletin. All the staffs at national, state level, regional level, and district level, and majority are FTP graduates. So they, what can I say, the graduates and the trainees, they work, they evaluate the surveillance, identify the gap, provide on-job training, and improve the surveillance of the country reports. They conducted more than 120 disease outbreaks, consisting like measles, polio, which of this country, COVID-19, they will participate from that country, diphtheria, neonatal tetanus, cholera, and many disease outbreaks was investigated. Now this country, previously they may need partners to help to investigate outbreaks and response on time. But now, the public health workers who graduates from FETP program are everywhere. Improving the surveillance system, conducting the outbreak investigation at the ground and responding. Not only that, they have a good position against positions. The National Surveillance Officer, the Emergency Operations Center head, the polio, the expanded immunization managers, and all the state heads are FTP graduates. So you can say this country now has improved the workforce development from that. This program, we give a very mentorship program. One of the main issues which make very successful is the mentorship. We provide the local capacity for the country. We conducted trainees at the ground, and also we established what's called commentaries, who are the graduates for the first cohort and now working as a mentor now.
We in the Minister of Health and highly appreciate the role of African CDC, USA, AFNIT, and WHO in implementing this program. We are grateful the role of our partners and the donors who support the health sector in Somalia. We are grateful their role in making successful this program. We hope to continue such useful programs and we wish to upgrade the frontline to intermediate and advanced levels. Thank you for your support. Thank you always for your support in the health sector of Somalia.
With the commitment of all partners, we look forward to the continued growth and success of the Field Epidemiology Training Program in Somalia.